So when we talked about depression, we reviewed one type of psychotherapy, psychodynamic psychotherapy, and now I want to give you an example of cognitive behavioral therapy for social anxiety disorder. So a person who is anxious with being in front of people will have various cognitions. The people will see that I'm a failure. And then if I get anxious, I'm going to lose control. I should be a fantastic lecturer and very comfortable talking to an audience or to a video camera. And, you know, I might offend somebody by saying something in my talk that is politically incorrect. So I have all these fears. This leads to emotions, shame. I'm ashamed of some of the things I said during my lecture. Fear, like I'm become afraid of giving lectures. Guilt, because I've said something wrong or I might have hurt somebody's feelings. And embarrassment that my arms were shaking and my voice was quivering while I was giving a lecture. This leads to behaviors. I may actually avoid giving lectures every time somebody asks me, hey, can you teach the physician's assistants programs a little bit about depression? I'll say, oh no, I can't. Or that week I have something else that I must do. There can even be, in social situations, a person escapes, or they engage in safety behaviors such as drinking alcohol. And what that does is the behavior then reinforces the cognitions. Gee, I couldn't go to that bar and talk to people. I had to drink to be able to do it. I'm such a failure, I'm such a loser. And that then keeps the progress going in a vicious loop between cognition, emotion, and behavior. So what does cognitive behavioral therapy do? First, we confront the distortions that lead to the emotional difficulty. So in cognitive therapy, there are 10 major forms of self-defeating thoughts. I want you to take a look at this and read the examples, because they're going to be helpful and you're going to need to know this for tests. I'm just going to give you an example of emotional reasoning. So you assume that your negative emotions reflect the way things really are. I feel terrified about going on airplanes. It must be very dangerous to fly. I feel guilty. I must be a rotten person. I feel so inferior. That means I am inferior. For you as medical students, it's going to be, I feel like I'm an idiot, or I feel like I'm an imposter, therefore I must be an idiot, or I must be pretending to be a medical student. So that's emotional reasoning. In fact, I tell trainees, if you walk around feeling that you're incompetent, you're probably going to be a more competent doctor than someone who walks around who's smug and feels like they know everything. So in fact, emotional reasoning is a distorted cognition that will make a person feel worse, as opposed to realizing it's a good thing that I feel a little incompetent, because it makes me ask questions of other people, look things up, and makes me a very careful physician. So here I am giving the lecture and I'm thinking, oh my God, I'm boring you guys to death. Well, that would be mind reading. I'd be reading your mind. Fortune telling. They're going to fill out my evaluations. I'm going to get all these low scores. Well, that's I'm predicting the future. That's a cognitive distortion. Catastrophizing. Oh my God, my lecture is so bad, I'm going to be fired, and then I'm going to be humiliated in front of the whole medical school. And then what one cognitive therapist called masturbation. The audiovisual and sound system must work well for each of my lectures. The more you say to yourself, this should be this way, this must be that way, the more you're going to create anxiety for yourself. And then again, I feel like I'm a bad teacher, therefore I am a bad teacher. Well, fortunately, feeling like you're something does not translate into actually being that thing which you fear. Okay, so CBT attacks the cognitions, then attacks the emotional arousal via physiologic reconditioning. We talked about these 3 techniques before. Many people with anxiety breathe through their chests rather than through their diaphragm, and so we teach them how to do diaphragmatic breathing deep muscle relaxation. If you've ever done yoga, you clench muscles from your toes all the way up to your scalp and then release the tension. And that ends up causing general relaxation of the whole body, kind of calms a person down. And then people using scenic imagery, like imagining themselves on the beach or some other place where they feel perfectly content and calm. Every time a person feels like the autonomic nervous system is ramping up, they can practice one or more of these techniques to chill out. Okay, the next kind of thing for cognitive behavioral therapy is to stop the avoidant behavior. Best way to do that is to expose somebody gradually to the feared event. So let's say I have a phobia in talking to an auditorium filled with 1,000 people. My first step might be to give a talk in front of a group of 2 or 3 friends. And once I can overcome that anxiety, I can start going to bigger and bigger audiences. And eventually, I'll see that I'm doing fine, I've been exposed, and I'm no longer freaking out about coming and giving a talk. So CBT attacks each step along the way, and it's highly effective for anxiety disorders. So exposure therapies set reasonable goals, confront the fear in graduated fashion, expect to be afraid, and actually be anxious. Because a common thought a person says is, I must not be anxious. But we say, no, be anxious. That's what we're working on. Go ahead, we want you to be anxious. Don't escape the phobic situation. The longer you face it, the better it's going to be to reduce your anxiety. Keep repeating these situations until you've mastered them. And don't punish yourself if there's been a failure.